Hello everyone, I'm Dr. Spinach. For those who do not know me, I am a foreign medical graduate, completed my FMGE, thereafter went on to pursue Plab exams, did my OET, Plab 1 and Plab 2 and got myself GMC registered, General Medical Council retained registration. Currently, I am doing residency in psychiatry, so I am a second year psychiatry trainee. In this video, we are going to talk about 6 things you should not miss in Plab 2 history stations. For this video, you need to very importantly have a pen and a paper. So this is the basic structure of history stations, and these are the questions that need not be missed and should not be missed in any history station unless otherwise. Alright, so the structure of history station requires 6 important things to be asked. Let's start with the first one. The first one is presenting complaints of the patient and elaboration of the presenting complaint. I like to abbreviate it as PC plus E. So presenting complaint of the patient and elaboration of those presenting complaints. So that is the first thing. Now moving on to the second thing, that is history of presenting complaint, abbreviated in my terms as HOPC. In history of presenting complaints, you actually ask details of the presenting complaint that the patient has just told you. For example, if the patient is in pain, then you're going to use Socrates, that is SOCRATES, and if the patient is complaining of anything other than pain, then we use ODIPARA, that is ODIPARA. Well, opening up the abbreviations for Socrates and ODIPARA, S in Socrates stands for site, O for onset, C for character, R for relieving factors, A for aggravating factors, T for time, E is for exacerbating factors, S is for severity, that is the range in which you are going to score the pain, so it is like a pain scale. There must be something that I must have missed in the Socrates. It will be on your screen, alright. Moving on to ODIPARA. ODIPARA O stands for onset, D for duration, I for intensity, P for progression, A for aggravating factors, R for relieving factors, and the last A is for any other symptoms or anything else. So in HOPC, we have to elaborate the history of presenting complaints. So we are going to take the details of that. This was the second thing. Now coming on to the third thing, that is once you have gotten a history, once you've gotten the symptoms in your mind, once you think this might be the diagnosis and you're thinking about, well, what can be the complications of this thing? What can be the red flag that should not be missed in this thing? So that is when you start asking about the red flags. Now, for example, if the patient comes to you with the complaints of vomiting or diarrhea, what the red flag would be dehydration, because dehydration can lead to imbalance in serum electrolytes, which can actually lead to a lot of, morbid problems like arrhythmias in case of decrease or increase in potassium levels. So you need to be careful about that, and you need to ask questions regarding dehydration to the patient. So red flags need to be ruled out in any situation, in any case. Similar to red flags are differentials. Now, vomiting can just not be because of gastroenteritis. It could also be because of some other diseases. So it is important for you to rule out other differentials in the category that you're thinking. So you're going to ask your questions according to that. So the third thing that I like to mention is, well, in abbreviated form, is RF plus DF. RF stands for red flags and DF stands for differentials. So until now we have seen PC plus E, that is presenting complaints plus elaboration, HOPC, that is history of presenting complaints, and RF plus DF, that is red flags and differentials. Now moving on to the fourth one is, well, asking about the past medical history of the patient. Well, I like to take it in an abbreviated form as MMAF, alright? And before MMAF, just add a B, that is before. So, has something like this happened to you before? So if the patient comes with complaints of chest pain, you can ask the patient, has something like this happened to you before? Has something of the same sort? So that is like before. Alright, then you go on to ask about their medical condition, if they might be having from past any medications that they are taking for any chronic illness or presenting illness. Then comes allergies to any medications, because you will be prescribing medications later on just in case. And finally, F stands for family history of any medical conditions that will help you diagnose the medical condition if it runs in families. Alright, so that is about the past medical history. That was the fourth one. Coming on to the fifth one, that is, well, the lifestyle and personal history. Now, in the lifestyle and personal history, we ask about DESA and TOSA. Now, what is the full form of DESA? I'm probably sure most of you know already what is DESA. Well, DESA stands for diet, exercise, smoking, and alcohol. I hope you guys are making notes of this, because all of this, the structure that I'm telling you, is a golden structure, and this is my structure that I use in my exams, and I am actually giving this out to you. So please make sure that you make your notes and really revise through it, because it is not a hard and fast rule to learn this structure and perform similar to this. No. But at the back of your mind, you should know that you have not missed anything that was important to be asked. And that is why this history station or history structure is important. Alright? So coming on to the fifth one again, we were on DESA and TOSA, lifestyle and personal history. So DESA stands for diet, exercise, smoking, and alcohol. And TOSA stands for travel history, occupation, social history, and A stands for last. Is there anything else that you might be missing? So anything else? Alright, so that completes the fifth one, and the sixth one finally is the one that is going to decide whether you will pass your station or not, and that is ICE, breaking the ice. ICE, ideas, concerns, and expectations need not and should not be missed in any history station. So the first thing that you will ask the patient, let's say that you have gotten everything from the station, and now you have this diagnosis in your mind or differentials in your mind, and or sometimes you may not be clear what could it be. So, and you really need to know if the patient knows what you are going to treat. So, that is going to save your time in actually explaining the illness that they are having. So, ideas is for asking them if they have any idea about the illness that they are having. So it is going to fulfill a lot of purposes. So ask about if they know about their illness, if this is a new case. Not in case of follow-up, if a patient comes with diabetes, you do not have to ask that. But in case of new cases, yes, a definite yes. And then comes concerns. If they have any concerns regarding their illness, and what do they expect from you regarding the treatment. So why are concerns and expectations important? Because they are going to help you tailor your management plan according to their needs. You're not going to give them so much of information about the disease. You're only going to give them what is important to them, rather than what you think is important, or what is the management plan according to you at the back of your mind in case of that disease. Alright, so these are the 6 things that are very important in all history stations. But again, it is very important. You're only going to have 8 minutes in total in your Plab 2 exam, and you may not have time to ask everything. So in that case, you will need to choose the relevant information from the structure that you are having at the back of your mind, or the structure that I have given to you just now. So you have to ask yourself, is diet and exercise important in this case? Can I skip travel and occupation history? Do you think that history is important in this case? So you will have to ask these questions and skip the things that are not important, that are irrelevant to your case, and keep on asking the things that are relevant in your case. Make it very concise according to you, according to the disease or the illness that you are treating. Alright, so again, let us just give a brief, let us just go through the brief of what we have learned in this history station. So the 6 important things that you need not miss in any history station, in all history stations, or you can say the best and the golden structure of history stations in Plab 2 is this. The first thing is asking about presenting complaints plus elaboration, PC plus E. The second thing is history of presenting complaints, HOPC. The third thing is red flags and differentials. The fourth one is medical conditions, medications, allergies, or any family histories. Fifth one is lifestyle and personal history, DESA, TOSA. And finally, we are going to ask eyes. Alright? Well, this was about the structure of the history stations and 6 important things to be asked in all history stations in Plab 2 exam. I really hope that you learned something out of it, you liked my video, and well, if you think this was useful for you, please share it with your friends and your colleagues and anyone that you think can benefit from my video. Well, I have restarted taking Plab 2 classes, one-to-one Plab 2 classes to help you tailor for your exam needs. So if you are interested in booking my Plab 2 classes, please go to the description below. You can message me either on Instagram or on my email, whichever suits you best. I mostly use Instagram, so if you have Instagram, please feel free to message me wherever you want. Alright, dr__spinach, all in small letters, is my Instagram ID. Well, you can find me, follow me, and message me for any classes that you would like to have. I hope, again, this was useful to you, and if you like my video, please give it a thumbs up, share it with your friends, subscribe to my channel if you have already not done so, and, well, what can I ask more? You've been lovely audience. Thank you so much for always being here with me, and well, let me know in the comment section below if you have any further questions, any further videos that you would like me to make for you, and that would be my pleasure. Okay, thank you very much. I will see you in my next video. Bye.